Hello, everyone. My name is Andrea, and I will be presenting the article Cost Approach of Healthcare Entity Intangible Asset Valuation by Robert F. Riley. So, what are the most important takeaways from this article? I've highlighted them below. So, the cost approach method wasn't as effective when used alone. It was best used with the two other valuation methods, which are right here. They're market approach and the income approach. So using the cost approach method is beneficial because it contributes to healthcare's operational effectiveness and ultimately leads to better financial outcomes and decisions. So what are the important facts to support this takeaway message? Well, to start, I wanted to highlight the definition of the cost approach. So the cost approach is the approach where it values an asset based on the cost to recreate or replace it. It is a fact that intangible assets don't have a set cost because they're not actual physical assets. So it's a very flexible variable and it can be affected by a series of like outside variables. So there's not really a price you can set on that. For example, something like patient relationships, specialized care models, and brand reputation. And despite some of these outside factors, the cost approach is essential in creating efficiencies that will lead in the long term to cost savings and better patient outcomes. And healthcare organizations can use this approach to help allocate the proper cost for investment decisions and, like I said before, financial decisions. Do I think this article is outdated? And so, what information is more up to date on the topic? I personally do not believe it is outdated. I think that many of the concerns that were stated in the article before are still really relevant to present day. Even with all the technologies we have a lot of data analytics software and AI, especially to help predict the costs. It's really hard sometimes to gauge public perspective. I think we've seen it plenty of times in our world that, one day a brand looks really good and the next day they are not doing so good and therefore it affects the cost, right? Um, so there's no way to predict sometimes how that will go. Um, and also because of the way technology has progressed, I think that this article is more relevant now than ever because intangible assets have grown a lot thanks to the digital age. A lot of stuff is now in softwares and programs. So that's all intangible assets. So how does this article tie into the content for this lesson? Um, So in this week's lesson, we learned about MSDRGs and how is the system used to classify hospital cases into groups for the purposes of payment based on diagnosis, treatment, and resource utilization. So understanding the costs related to these intangible assets, um, like I said in the previous slide, like proprietary health practices or patient care models, it can help healthcare entities to better allocate their resources when determining the MSDRG reimbursement amounts and managing healthcare delivery. By understanding the cost of these assets, health organizations can make better decisions about how to approach the cost and resources to these different MSDRG groups. So what can we apply from this article to on-the-job situations? Um, well, now we know that using the cost approach method along with the income and market approach to evaluate intangible assets, it's better overall than just using one single method. Um, It helps us understand how these assets contribute to the overall cost structure of the services we provide. So in HIM, we can be involved in managing and overseeing healthcare billing and reimbursement and financial reports. So this article helps us understand how this cost approach can help indirect costs associated with the healthcare services that don't typically show up. So now we have that insight of like, okay, well, we need to take this into account into the cost approach, right? So overall, it would help with decision making about service pricing and reimbursements. And like before, we use MSCRGs to measure resource consumption. Using this cost approach in HIM can help us to determine the true cost of delivering care. Thank y'all very much, and I hope y'all enjoyed my presentation.